Alright, I'm just gonna do my room scan here. I have my supplies. I don't have a rubric. They are open because I was using them to practice. Garbage. Joe. Joe. Okay. Sure that I get this is about as high as it can go. Just making sure I have everything all right. Hi Joe, my name is Danielle. I'm going to be your student nurse today. I'm performing hand hygiene and providing privacy. Can I get your first and last name and your date of birth? Awesome, just checking your wristband. So looking at provider's orders, it looks like I'm going to be doing a dressing for your chest tube that was inserted today. Is that okay? Awesome. You know, you're kind of lying in an uncomfortable position, so I'll try and get this done as soon as I can. I've provided privacy. I checked my provider's orders, hand hygiene. Do you have any allergies, Joe? Just the sulfa. Perfect. I'm just going to, actually before I do that, I'm going to, before I put gloves on, I'm going to get my tape ready. It's kind of long. Just hope you can see me good enough. I'm just gonna move this forward some so that you can see what I'm doing better. Alright, now I'm going to put on my gloves. I'm going to connect my suction. Perfect. I turn on my suction and take off my hemostats. I'm going to take my tape and secure my tubing. Do one around here to ensure that's seal. Alright, I'm going to take off my gloves for hand hygiene, and I'm going to set up my sterile field. Starting, I make sure I'm well positioned first before opening. So I'm going to open it away from me, only touching that 1-inch border. That open. Got my 4x4 split gauze. I'm just gonna make sure, okay, so I'm gonna redo that. So in real life situation, I would grab new supplies because I contaminated my sterile field by not placing this within that 1-inch border. So I got my new my new sterile gauze, and I'm just going to open and flip that so it's within that border. And then, alright, so I just had to pick this up, otherwise I would not put my hands below the waist or turn my back, but this fell off when I picked these up. So my sterile wooden gauze, rip open and put that over, and then I have my Vaseline. I'm just going to manipulate it a little bit so that it comes out, making sure I don't reach over the sterile film. And there. Alright. Now I'm going to get my sterile gloves and put them on. Making sure I don't turn my back. First I'm going to put on my right one because I'm right-handed. Oh wait. Yeah, that's fine. Okay, now that my sterile gloves are on, I can touch my sterile items. So first I'm going to open up that up, keeping it within that 1-inch border, and then I have my gauze and my two things, and I'm picking up my hemostats. Okay, so the first thing I'm going to do is I'm going to take my sterile and I'm going to place it over, not touching the tweezers on the tube or the skin. The skin is not sterile. I'm kind of struggling to manipulate, and I don't want to touch.
And we have a ton of these that came out of the clinic or something, so why do you order the exact same one in the clinic as we did here? I can do it.
Now I'm going to grab my sterile gauze, my 4x4. Are you kidding me? Sorry, I dropped it. If I can touch the sterile gauze with my tweezers as long as I don't touch. Are you kidding? My gauze keeps sticking to my hemostats. So, it's fine. Right, I'm going to sacrifice my other sterile hand, and just so I can get this around my hemostats, stop sticking to my gauze. Okay. Now I'm going to take place that on top. Okay. Now I'm just going to, I'm not touching the gauze, I'm just moving this towel here so that I can tape. So now I'm going to take my tape.
You have to twist it to get it in.
Now, the tape doesn't stick very well to the mannequin, but I'm going to try my best. So I can touch the tape with my gloves, but I cannot touch the gauze with my gloves. Otherwise, I'm breaking sterility. Gosh dang it. The last of it here. I'm going to rip this part off just so that I can get this to go under. And then
I mean, I can work on it.
It's not the prettiest,
It's just not gonna.
but I'm just making sure that there is a good seal around that. And I'm going to put the date, my initials, and time, and I'm going to secure the tubing to my patient as well. Okay, looking at the chamber, I'm making sure that there is only dependent loops, and there is. I'm going to look at the dressing to make sure that there's no drainage coming through, or to make sure that there's no bleeding underneath the area. I'm going to palpate the skin, feeling for Rice Krispies, which is also known as a subcutaneous emphysema, which is air underneath the skin. Looking at my collecting chamber. Oh, there we go. Okay. Are you kidding me? Why does everything have to be a struggle? Okay, so looking at my chamber, I'm going to note the amount of drainage that's in there. If there's more than 200 in the first hour, I would alert the doctor. If there's more than 100 if there's more than 100 per hour after that first hour, then I would also alert the provider. I'm going to note the color, amount, and consistency. I'm going to make sure that the water chamber has 2 centimeters of water in there. Titling is normal. Bubbling means that titling is normal during breathing, coughing, sneezing, or bearing down, and then bubbling means that there is a air leak within the dressing or the tube. And for the suction, I'm going to make sure that's at -20. Moderate bubbling is normal, but vigorous means that the suction's too high. The moderate bubbling means that there is just the moderate bubbling means that the suction on the wall is at the right degree setting. All right, taking off my gloves and washing my hands, and that is all.